Hi everyone. Today in this video we are going to discuss about side effects of amiodarone in easy way. What is amiodarone? Amiodarone is one of the class 3 antiarrhythmic agent, and within this class we can observe few of the other drugs like sotalol, dronedarone, ibutylide and dofetilide. But among this category, amiodarone is a special drug which is even classified as a class 3 antiarrhythmic agent. Still, this drug shows other class actions. So, amiodarone shows class 1, class 2, class 3 and class 4 actions. So, this drug acts by multiple mechanisms, but its main mechanism of action is to block the voltage-gated potassium channels. So, that's why it is classified as class 3 antiarrhythmic agent. So, this drug mainly acts on the phase 3 of action potential. Normally, the action potential in the heart is like this. Here, amiodarone blocks the voltage-gated potassium channels, thereby delays the phase 3 repolarization. And because of this delay in the phase 3, we can observe that the action potential is somewhat increased. So, the effective refractory period is increased by amiodarone because of the increased action potential duration. So, in this way, amiodarone can increase the effective refractory period, and particularly because of this mechanism, amiodarone can reduce the re-entry type of arrhythmia. So today in this video we are going to discuss the different types of side effects produced by amiodarone which can be remembered in easy way. So here one of the side effects of amiodarone is directly related with its mechanism of action. Now this drug is going to increase the action potential duration. So during this the plateau phase is going to be increased, and during the plateau phase the calcium is more entering into the cardiac muscle, and because of this intracellular calcium levels may be increased. And when these intracellular calcium levels are increased, this can produce the cardiac arrhythmias by increase the intracellular sodium levels. So amiodarone, even it is a class 3 antiarrhythmic agent, but still it acts as a proarrhythmic. That means this drug again can produce the cardiac arrhythmias, and particularly when this drug is used, it can increase the QT interval within the ECG, resulting in precipitation of one of the fatal condition, torsade de pointes. So this torsade de pointes is one of the side effects that can be observed with all drugs within this class 3 antiarrhythmic agents. So it is not a specific side effect that is produced by amiodarone. But now let us see what are the different types of side effects that are mainly observed with the amiodarone. Amiodarone can produce toxicity on many of the organs. First one, it can affect the lungs, and it can also affect the eye. Similarly, it can also affect the liver as well as skin. In this way, this drug shows the toxic reactions on many of the organs. But here we can remember these side effects in an easy way. So before that, let us see the structure of amiodarone. So what is the structure of amiodarone? Amiodarone is having the structure like this. And here we can observe it is having the tyrosine-like residues. This phenyl ring is attached with the two groups which are the iodine moieties. These iodine moieties are responsible for the few of the side effects of amiodarone. So amiodarone is the iodine containing class 3 antiarrhythmic agent. So here we can remember the side effects of amiodarone when we consider the iodine moieties. What are the side effects that can be observed when the iodine is excessively consumed? So iodine can produce a toxicity on many of the organs. So iodine can affect the thyroid glands. So when this excessive iodine is given, it can reduce the thyroid levels. So iodine can affect the thyroid levels. Either it can increase or decrease based on the amount of the iodine that is going to be consumed. Similarly, this iodine can also affect on the eyes so that it is going to produce the ocular toxicity, and it can also affect the skin to produce the staining. When the iodine is going to be placed on the skin, it produces the staining of the skin, and it can also affect the neurons to produce the peripheral neuropathy. Finally, it can also affect on the liver, and it can produce the liver injury. So all these are the various side effects that can be observed with the iodine when it is excessively consumed. So just for easy remembrance, we can consider the same side effects that can be produced by amiodarone. But all these side effects are not because of the iodine moiety. For example, thyroid abnormalities as well as staining of the skin may be attributed to the iodine moiety within the amiodarone. But other side effects may not be directly related with the iodine moieties. Now let us see the side effects of amiodarone. Amiodarone produces various side effects. It produces a blue to grey discoloration of the skin, corneal deposits, hyper or hypothyroidism, hepatotoxicity, pulmonary fibrosis, and peripheral neuropathy. And we can easily remember these side effects with a code BCHHHPP. B is for blue to grey discoloration of the skin, C is for the corneal deposits, and one of the H is for hyper or hypothyroidism, another H is for hepatotoxicity, and one of the P is for pulmonary fibrosis, and another P is for the peripheral neuropathy. So just by remembering this code and logical relation with the iodine moieties, we can easily remember the side effects of amiodarone. So let us discuss these side effects one by one. The first one is the blue to grey discoloration of the skin. Amiodarone is a iodine containing class 3 antiarrhythmic agent, and because of this iodine moiety, this drug can produce a phototoxicity. This phototoxicity results in the discoloration of the skin, which may be appeared as blue to grey color, and this phototoxicity is further increased by exposure of the skin to the sunlight. So those patients who are treated with the amiodarone, if they are directly exposed to the sunlight, there may be increased staining of the skin to blue to grey color. And particularly this side effect is more observed with the long-term use of the amiodarone. When this drug is used for long term, the amiodarone levels are accumulated within the body, which is further increasing the phototoxicity. In this way, first important side effect of amiodarone is the blue to grey discoloration of the skin because of the long duration of therapy as well as by exposure to the sunlight. Second one is the corneal deposits. Again, amiodarone can produce some ocular toxicity, and because of ocular toxicity, it can produce a corneal deposits. We can just remember this side effect as iodine can produce some staining on the skin as well as the cornea, but this ocular toxicity may not be related with the iodine. And particularly this drug produces the micro deposits on the cornea. These micro deposits are not directly observed by physical examination, but still they can affect the function of the eye. So because of these micro deposits, amiodarone can produce some blurred vision as well as some visual impairment. Some halos can be observed in the vision. At the same time, this drug can also produce the optical neuritis when this drug is used at a high dose for long-term therapy. This optic neuritis, even this is a rare condition, it can produce some vision loss as well as the macular degeneration. But these side effects are observed only at the high dose greater than 400 mg per day and when this drug is used for long-term period. Fortunately, these ocular side effects are reversible. So when this amiodarone is stopped, again these corneal deposits can be restored in the patients. Third one is the hyper or hypothyroidism. Again, this side effect of amiodarone is related with the iodine moiety. Amiodarone is going to inhibit the peripheral conversion of the T4 to T3, where the T3 is the active form of the thyroid hormones. So because of this, amiodarone can inhibit the thyroid activity, as well as this drug can also increase the inactive T3 forms, which again results in the decrease in the thyroid activity. And finally, when this amiodarone is going to be metabolized, it can release the iodine, and this iodine can suppress the thyroid activity. In this way, amiodarone can produce either hyper or hypothyroidism. So this drug can produce a hypothyroidism, which can be tested by elevated levels of thyroid stimulating hormone. This hypothyroidism is somewhat less severe and it can be controlled by the external administration of the thyroid supplements. But another side effect of amiodarone is the hyperthyroidism, which is more significant. This hyperthyroidism may result in the agitation as well as irritability in the patients, and this can also increase the cardiac arrhythmias in the patients. Normally, amiodarone is used in the cardiac arrhythmias, but because of the hyperthyroidism, it can further increase the cardiac arrhythmias, which may sometimes lead to the fatal death in the patients. That's why whenever this drug is used at a high dose, the hyperthyroidism should be thoroughly checked because it may lead to the increased risk of cardiac arrhythmias. Fourth one is the hepatotoxicity. Again, this side effect is observed with amiodarone when this drug is used for a long-term period. This drug can elevate the liver enzymes like the SGPT as well as SGOT. So these transaminases, when they are going to be elevated, it indicates some liver dysfunction. Normally, these elevated enzymes will not produce a complete liver injury, but when this drug is used for long-term duration, they can produce a severe liver injury and hepatotoxicity. Fifth one is a pulmonary fibrosis. This is one of the important side effects of the amiodarone. This drug is going to increase the pulmonary toxicity, which may result in few of the symptoms like bronchospasm, wheezing, cough, as well as this can also increase the body temperature resulting in the fever. and other side effects like dyspnea, shortness of breathing, as well as hypoxia, lack of oxygen supply. And at toxic levels, it can also produce the alveolar hemorrhage, which should be carefully monitored. So this is one of the important side effects of amiodarone, pulmonary fibrosis, which should be carefully monitored. Sixth one is the peripheral neuropathy. This drug can also affect the peripheral neurons such that the neuronal sensation is somewhat reduced, and this drug can produce some numbness, burning, stinging, as well as tingling in the feet and hands. And some muscle weakness can also be observed with this amiodarone because of the peripheral neuropathy. This is a rare as well as reversible side effect. Whenever the drug is going to be stopped, these symptoms can be relieved in the patients. So these are the 6 important side effects of amiodarone, which can be remembered as BCHHPP. B is the blue to grey discoloration of the skin, and C is the corneal deposits. H is the hyper or hypothyroidism, and another H is the hepatotoxicity. P is the pulmonary fibrosis, and another P is the peripheral neuropathy. So amiodarone is a iodine containing class 3 antiarrhythmic agent, which can produce few of the side effects like thyroid abnormalities and staining of the skin because of the iodine moiety. And other side effects like the ocular toxicity, liver toxicity, pulmonary toxicity, and peripheral neuropathy are again produced by amiodarone, which may not be related with the iodine moiety. So that's about the side effects of amiodarone that can be remembered in easy way. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.